All right, today we're performing catheter care. The first thing I would do is I would check the order to ensure that's what we're doing, and we are, so I'm going to engage with the patient. Hi, my name is Warren. Looks like today we're doing a catheter. Have your name and date of birth, please. Checking the wristband. Do you have any allergies? Food, medication, latex? No? Sounds good. So we're going to go perform our hand care. Wash our hands. We're going to gather our supplies, making sure there's no perforations, none expired, everything's intact. I'm going to don my clean gloves. That if I had any malfunctions with, I would fix once the gloves are on. And I'll re-engage with the patient. I'm going to go ahead and expose the working area. Being a female patient, we'll place her in the dorsal recumbent position. If it were a male, it would be the supine position. I'm going to perform peri-care on the patient, cleaning from front to back with hot soap and water, warm rather than hot. Dispose of those supplies. Remove my clean gloves. Perform hand care again. And I'm going to start getting my equipment ready. I'm going to remove my kit from my bag. And the bag will double as a trash receptacle. I'm going to open my kit away, side, side, and toward. And I'm going to put my sterile gloves over here. I'm going to open them in a similar fashion. And my gloves have seen better days. Now I would do this a lot more gracefully, but I'm having issues here, so. For my second pair, I'll go in like so, keeping my thumb out of the way. All right, I'm gonna get my sterile drape. I'm gonna place it under the patient. Making sure not to touch them. And if I had, I would need to replace my sterile gloves. I'm going to get my supplies ready. Keeping everything within 1 inch of my sterile field here. I'll go ahead and get my catheter ready. Unsheathing the tip there. And I would put lubrication on it, about 2-3 inches down. And I'd place it in my tray in order to keep it lubricated and sterile. I would have betadine ready in here as well. And I would go ahead and start preparing my syringe by just connecting it on there so that it's ready when I go. I would not allow that to flop off of the tray. It would stay in my lubrication, and I would keep everything together as I gracefully bring it to the patient. All right. Got my supplies, and I'm going to place them like so. Again, being conscious of touching the patient and contaminating my gloves. I would use my betadine swabs, and I would clean left, top to bottom, right, top to bottom, and down the center, being cognizant of going over the patient. If it were a male patient, I'll be doing it in a circular motion from the tip of the meatus to the glands. All right. So now with my lubricated catheter, I'll go ahead and commit this hand to holding the meatus open, and I'm going to ask the patient to bear down. With the urethra dilated, I'll go ahead and begin insertion, little by little. Again, with it being a female, I would insert until I see urine beginning, and then I'd go about 2 or 3 inches more. If it were a male, I'd go all the way to the bifurcation. Now that I've seen urine, I'll go ahead and begin inflating the balloon. And I'm holding the catheter in place to assure it doesn't slide out any and cause any damage with the balloon. Okay. Disposing of the syringe. I'm gonna give it a gentle pull just to ensure that we are anchored in. I'll take the catheter bag across the upper leg and I will anchor it to a stationary place on the bed. I'm anchoring it to the top of the leg so that this doesn't pull or move around any, so we don't kink the catheter, and because placing it here causes the least likelihood of skin breakdown. I'm going to clean any excess betadine. I'm going to remove all my supplies. And I'm going to place the patient back in a comfortable position. All right. Is everything okay? Are you in any pain? Do you have any questions? You have your call light? Okay. Let me know if you need anything and I will exit. Once you check the order and we've established that it's time to remove the catheter, we're going to re-engage with the patient again. We're going to let them know what the procedure is, of course, identifying them and doing all of those things. I'm going to step away. I'm going to perform hand care, don clean gloves. I'm going to empty the catheter bag, and I'm going to document the output. Once that's complete, I can go ahead and expose the working area again. Being a female, placing her in the appropriate dorsal recumbent position. And I will use my clean syringe, my clean new syringe. And I can begin drawing out the excess fluid. Now, when I begin on an actual patient, the syringe would rebound and I would let it draw. But for the purposes of this, I will manually draw out all the fluid. And that way we can ensure no damage happens when I begin to remove it from the urethra. Now I'm going to go ahead and roll it up like so. I would disconnect it from the leg anchor. I'm going to continue rolling it. I would place my entire kit in the trash. Removing all my supplies. And I can return the patient to a comfortable position. I would also perform peri-care in order to remove any excess. Upon completing the procedure and ensuring the patient isn't in any pain and they're okay, I would explain to them that they may not have the urge to urinate again for another 6 hours, and that if there's any pain or what have you, they need to report it immediately. I make sure they have their call light, they're safe, got the rail back up, and clean up all of my mess, perform hand care one more time, and I would leave the patient.